Hello everyone, this is Rohit Varghese again, back again for week 13. And I have another set of 3 questions that I wanted to talk about today. So the first question was, a client has a left ankle injury and is instructed to use crutches when ambulating for 4 weeks. The nurse is observing the novice nurse provide instructions to the client. Which instruction causes the nurse to intervene? And so there are 4 answer choices. The answer choice that I picked was answer choice number 2. Place the hand grips of the crutches at hip level. This is incorrect. We have to provide instruction and information to the client about body positions that eliminate the potential for repetitive stress injuries. The correct answer that we need to pick is option number 1, which is actually a cause for concern, which is what we're looking for. Excuse me. Option number 1 states, place the top of the crutches about 5 inches below your armpits. So what we actually have to do is that proper body position of crutches is to have the top of the crutches about only 2 inches below the armpits, not 5 inches. So answer choice number 1 is concerning and something that the nurse should intervene for. Moving on to the next question I wanted to talk about. So this is a very short question, but for some reason I got it wrong. So the question states, the nurse assesses a client who is receiving a unit of packed red blood cells, or PRBCs. Which client finding most concerns the nurse? So there's 4 findings that were given. Option number 1 states temperature is 102.5 degrees Fahrenheit, which is 39.2 degrees Celsius, chills, and nausea. Option number 2 states headache and increased coughing. Option number 3 states temperature is 102 degrees Fahrenheit, which is 38.9 degrees Celsius, blood pressure of 92/60, and foamy oral secretions. And option number 4 was neck and chest itching and reddened skin. So the answer choice that I picked was option number 1, which is temperature is 102.5 degrees Fahrenheit, chills, and nausea. And so this is incorrect. Fevers, chills, and nausea are associated with the febrile reaction. Additional signs or symptoms include rigors, headache, flushing, anxiety, vomiting, and muscle pain. The client may need antipyretics and the healthcare provider's approval to continue to transfusion. So that's why this is not really a concern. What is a concern is option number 3, which states that the temperature is 102 degrees Fahrenheit, blood pressure of 92/60, and foamy oral secretions. This is correct because these are the signs and symptoms of transfusion-related acute lung injury, or TRALI. Symptoms may occur within 1 to 6 hours of transfusion and include fever, chills, hypotension, tachypnea, frothy sputum, dyspnea, hypoxemia, and respiratory failure. TRALI, or TRALI, is the leading cause of transfusion-related deaths. So the correct answer, which was most concerning to the nurse, is option number 3, not option number 1. Moving on to the next question I wanted to talk about. This is a select all that apply question. It has to do with cardiac monitoring. So the cardiac monitor of a client who is awake and alert and has a peripheral pulse shows VTAC with a rate of 160 beats per minute. Which action is appropriate for the nurse to implement? And so this is a SATA question. Select all that apply. And so there are 5 answer choices. The first one was defibrillate using 200 joules. Number 2 is monitor blood pressure. Number 3 is alert the rapid response team. Number 4 is prepare to administer adenosine by slow IV push. And number 5 is obtain a 12-lead ECG as prescribed. So the correct answer choices were 2, 3, and 5. But I picked 1, 2, 3, and 5. And so number 1 is wrong because the client is awake and alert. So synchronized cardioversion using 100 joules is recommended if medication fails to convert the rhythm. We don't really need 200 joules because they're awake and alert. They have a pulse. Option number 2 is correct because the nurse should monitor the client's blood pressure to determine whether the client is tolerating the rhythm. And I did click this answer choice. Option number 3 is alert the rapid response team. And so this is a correct choice because the nurse should alert the rapid response team to assist with the client's care. Evidence shows that rapid response teams help improve client outcomes when changes in condition occur. Option number 5 is also correct. Obtain a 12-lead ECG as prescribed. The nurse should obtain a 12-lead ECG as prescribed in order to evaluate the client's cardiac conduction. So that's something that we need to also do. So the answer choices that were correct were 2, 3, and 5, not 1, 2, 3, and 5. And with that, this is the end of our mediation for this week. I hope you guys have a great day, and thank you for listening.